I suggest to start this event. As I said, we will start on time. I would like to welcome everybody who is already connected. We have now 74, 75 people connected to this call. We're expecting much more. We have about 230 registered participants to this event. I expect about 80% or so to get connected. My name is Michael Nagy. I work for the UNECE Statistical Division in Geneva. Like many of you, I'm just working from home, and home in my case means Vienna, Austria, where I'm working from. I have to say that we were really overwhelmed by the interest of experts from national statistical offices, international organizations, and other organizations in participating in this event, and also in the interest in sharing their own experience or the experience of their offices. We also have received during the registration process for this event about 100 questions of interest that people proposed to be discussed at the event. Our panelists will try to respond to some of those questions, but you will understand that unfortunately it will not be possible to address all these questions and also to present all the examples that people have and want to share in the event. What we could do is, if there is interest by participants, that we could consider repeating this event and giving a specific focus on one specific topic. I'm personally very happy that today we have 6 distinguished panelists who will share their own experience and the experiences of their offices and respond to the extent possible to questions that came in the registration process or will come through the chat. We have also received some additional examples from national statistical offices that we cannot present today, but we make them available through our UNECE platform, and I invite you to have a look at it. Stella, could you please share the holding slide so that we can see the panelists and the reference documents? We cannot see the holding slide. Thank you. Before we start with the substantive part of this discussion, some rules and roles during the event. We already have mentioned it several times. Please make sure your microphones are muted unless you are invited to speak. And also would like to ask you to disable your camera unless you are one of the panelists or moderators, so that we have only the invited speakers on the screen. This is a very dynamic and interactive event. We would like to use the chat function for interventions coming from the audience. Only if time allows at the end, we would give you the floor for interventions in speaking. So the chat is our main way to communicate with each other. If you experience technical problems, you have all received the email address of my colleague Stella Derivolkov. So please either send her an email or send her a message in the private chat, and she tries to help you from the distance if you cannot solve the problem. So now we can see emails, but not the holding slide. Thank you. So let me start with this, with the rationale of this event. So why are we organizing this event? The idea came actually from members of our UNECE Task Force on Measuring Hazardous Events and Disasters. And we know that there have been similar events, for example, organized by the World Data Forum, UNSD, or the Inter-American Development Bank, also addressing challenges and opportunities for NSOs caused by this COVID-19 pandemic. And I know that several of you have already participated in such events, either as speakers or simply as in the audience. I think that this event today is the first of its kind, looking specifically and solely at the role of NSOs and official statistics to managing this disaster. I use the term disaster here on purpose. This is also an important terminological aspect I want to discuss here. In the terminology of the Sender framework, this COVID-19 pandemic fulfills all criteria of a disaster. And also our colleagues from the United Nations Disaster Risk Agency, UNDRR, speak of a COVID-19 disaster. So this means consequently, NSOs are not only important to manage the current situation and to contribute to the management of the current situation and to make plans in measuring the impacts, but also to see it from a perspective of Sendai reporting, but also SDG reporting, where we have certain indicators that also measure progress in disaster risk reduction. This is also the reason why you see here on the holding slide now under useful resources, references to important work that was carried out by expert groups of UNEC, but also colleagues of ESCAP, that should support official statistics in contributing to measuring and monitoring hazardous events and disasters. This event today is organized in form of a moderated panel discussion. It's the first time that we are doing this virtually, or I do this virtually. I have some experience in doing it in-person version. So please cross your fingers, we can come to a similar success doing this virtually today. So we have some challenges with that, but I think we can overcome them. So we will start with short presentations given by our 6 distinguished panelists, where they will share some main experiences they have. And then they will respond to some questions which we collected through the registration process or which the audience might have and which come through the chat. We also have foreseen some live polls to which you can contribute. Everybody can contribute, which should also stimulate a little bit the discussion during this event. And having said this, we have a very first question to all of you, and this is a kind of test question, but it also helps us to get a little bit an overview about who is connected, which institutions are you representing. I would like to invite you to go to a web browser or maybe to use your cell phone or any internet connected tool you have available and to enter this internet link that we have on the screen, which is www.menti.com. You see it on your screen now. And when you are asked for entering the code, please use this code 545209. Stella, I propose we leave this for another 20 seconds online that people see the code and the website. And then maybe we switch to the poll already, Stella, because there you can see also the link and the code. You can switch to the poll, please, Stella. And next one. So the kind of test question. So we would like to see which organizations are now, or representatives of which organizations are now connected to the call. But this is also a bit to familiarize you with the tool. Once you have contributed to this, you can keep the window open in which you have this menti.com. And when my colleague is switching to the next question, it will simply appear in your web browser or on your cell phone. So just keep it open. So what we can see here is that we have now dominance of people representing NSOs, followed by international organizations and some other organizations. Okay. We don't need here accurate answers. This was more like to make you familiar with this tool. So I would like to introduce now my colleague Daniel Clark, or colleague from OECD, Daniel Clark, who is a researcher and analyst at OECD. He's also well known in the disaster risk related statistics community for his work on the ESCAP disaster related statistics framework. So I guess many of you already know him. He will be moderating parts of this event. And also Stella Volkov, who is supporting us in this event. Stella is a statistician at UNECE. Many of you might know her from, and she's managing all this now from home in Moldova. Having said this, I would like to hand over to Daniel to introduce the first substantive session, which is a presentation of some case examples on NSO responses to COVID-19. And this will also then be, in this session, we are not going to take questions from the audience, but in the following questions we will do so. So Daniel, the floor is yours.
Thank you, Michael. I hope everybody can hear me okay. So again, I'm Daniel Clark, for research from the OECD. Thank you very much for the invitation to assist with the facilitation of this event. So again, we will get started with the sort of opening remarks, the introductory presentations by our six esteemed panelists. Sort of their key messages or key points that they wanted to present, and they each have a couple of slides to support their statement here in terms of the managing the COVID-19 crisis and responding to the disaster from the perspective of official statistics. So I will introduce our panelists just one at a time, just before their presentation, if that's okay. And we were going in, just for convenience sake, we will go in the alphabetical order of the country name from which the panelists are coming from. That's just a norm for a lot of these international meetings, just for convenience sake. So that means that our first presentation comes from Austria, Statistics Austria. It is Ms. Mattia Pasvan. Ms. Mattia Pasvan is a senior research officer of Statistics Austria, specializing in social statistics. And she's done research in the fields of survey methodology, including panel surveys, labor, health, mixed mode design, and communication strategies for respondents. All I think are interesting and relevant topics in the current situation. And she's going to give, we try to keep the presentations around 4 minutes if possible. And she's going to talk about the monitoring of the COVID cases and deaths in Austria. So with that brief introduction, the floor is over to you now, Ms. Mattia Pasvan, and I will control the slides from my machine here. So you can just let me know as you like to advance them.
Thank you for introducing. Yes, my name is Mattia Pasvan, and I'm happy to be here today and to present you two of our studies. So today I'm not going to present everything which was done at Statistics Austria, but I'm going to focus in detail on those two projects which we have done especially to help the government for evidence-based decisions, and also that we tried to provide additional data for researchers. So not everything that was done will be a topic today, but I think those topics are currently the most important, or the new ones for us. So the first thing, could you please show the next slide?
Sure.
Thank you.
Sorry.
No problem. So the first thing which we have done was that the government, and especially it was the Ministry of Education and Research, asked us if we could conduct a study to estimate the prevalence of COVID-19 people in Austria. So the goals of this study, or the goal of this study, the main goal was to estimate the number of people infected in Austria at the current time. On the other hand, as we always have a questionnaire and we ask people questions about their socio-demographic and other questions, we also thought that it would be a good idea at the same time to ask people how are they feeling during the crisis, what are they working, which problems do occur. So this was those were the two main goals of this study. And we worked together with the Red Cross and with the University of Vienna to conduct this study. We took a gross sample of 2,800 persons, and the basis was the population register of Austria. You can see down there a slide with points where the sample was selected from Austria. And we asked all the people to respond to our questionnaire. 1,577 people did answer our questionnaire. And during the question, we also asked them if they would provide us a nose and throat test for the PCR testing. And all of them said yes. In the end, the Red Cross could take 1,432 swabs from the nose and from the throat. And then the University of Vienna conducted a PCR analysis. And so based on these results, we could show how many, or we could estimate the number of at maximum infected people in Austria at the time point we did the study. We also had, I think you have to press a little bit more often. Yes. No? So thank you. But the first study, which was conducted at the end of April, it only showed how many people are infected at the moment of testing. What we couldn't say is how many people were infected or had antibodies. So we did a second and a rather experimental study to conduct at the first time to see, because there are a lot of antibody tests and a lot of antibody tests are not that valid or have not a very high validity. So we conduct this test for the University of Vienna so that they could see how good are the rapid tests which we use. And for this purpose, we didn't look at Austria as a whole because we needed to have a high number of people with antibodies. So we only focused on communities with a high number of prior infected people. And at the end, we had 27 communities. And from those communities, we asked for 540 people, again, to respond to our survey. And 270 did respond to our survey. And from 269 of those, we could take, again, a throat swab for to look at the actual infection. We also did, or not we, the Red Cross did a rapid test to see if antibodies are there. And additionally, they took blood, so a blood draw was made from the people to analyze the blood in the lab if there are really antibodies in the blood. So those two studies were very important on the one hand for the government to see how many people are really infected in Austria, and on the other hand also to look at could we use those antibody tests for the whole government, or are those rapid tests not good enough? Yeah. And currently, we are conducting a second COVID-19 study. Yeah, thank you, Daniel. And on the other hand, a colleague of mine, also from the social statistics, they provide on a weekly basis data of how many people are weekly deaths, so that people can look how does it change the number of people who died to prior years and to now. And what is also going to happen is that they also will analyze the causes of death. So what we now only see is how many people died, but not the reason why they died or the cause of death. So coming soon is that we also have, we will have the possibility to look on if there are more people dying because of COVID-19 or not. So this is a future step which is done currently at our organization. So thank you. You can skip those slides. These are just details of the results.
Okay, so that was the, sorry, there is a bit of a delay with my screen sharing, so I apologize for the not so smooth presentation of slides there. Thank you very much. Very interesting introduction to what's happening at Statistics Austria. Thank you for the keeping the opening presentation quite short. For the next presenter is Mr. Ivan Clermont from Statistics Canada. Ivan Clermont is Director General of the Analytical Studies Branch at Statistics Canada, and he is responsible for leading several research related to economic, health, and social issues for Canada. And I will do my best to advance your slides, Mr. Clermont, but now that I pass the floor over to you to discuss the work going on at Statistics Canada.
Thank you very much, Daniel. Can you hear me well now?
Yes, yes.
Very good. So I think we're going to move to slide 2 right away so we can start right in the bulk of the presentation here. So I won't be showing lots of numbers today. In fact, I'm not showing any numbers. I'm going to focus on the process and activities we did since the pandemic hit us in Canada. So following an urgent need to provide information on the economic and social impacts of COVID and support the efforts of several frontline agencies, namely the National Public Health Agency, we created what we call the COVID-19 Data Management and Analytics Services Virtual Center. It didn't take long for this group to become a hub for advancing and accelerating the modernization already on the way in our agency. The creation of new modern tools and methods of collecting data and creating indicators was key to that. So in order to be relevant, and respond to the various information requests, we have put in place a number of initiatives that you can see on the first slide here. And maybe what I would like to do here is to focus on the most important of these initiatives. So I'd like to mention here, we did the production for the first time of flash estimates of GDP and producer price index based on nowcasting methods and modeling, which improved a great deal the timeliness of those key economic indicators. We also launched various crowdsourcing data collection surveys on several topics, such as attitudes and health behaviors of Canadians, their mental health during the pandemic, the trust and safety of Canadians, questions related to education, and also one little survey on teleworking. So we also made a big use of scanner data to monitor near-time retail trade and consumer behaviors for specific industry. We put together also a geospatial visualization tool that also users can use to select and map and download data at a very fine geographical level for their research. And we produce a COVID web page. So I invite you to visit that page. It's on the first page of the Statistics Canada website. And you're going to see that we launched as well a new publication series on COVID specifically. And we have released 28 papers thus far on that topic. So in normal time, this would have taken us much longer to implement these initiatives, even though some were already in motion before the pandemic. So despite these several achievements, this crisis really highlighted a number of challenges impacting our ability to provide information in a timely and efficient manner. And you can turn, Danielle, to slide 2 here. So first, it's important to say that in Canada, public health is a shared responsibility. So is the data. So data on COVID cases is managed by various regional public health agencies and then centralized by the National Public Health Agency. The data on hospitals and health resources and system performance are collected by another federal agency. And our role as an NSO in this area is mostly to collect and produce population health measures on Canadians. Therefore, health information is distributed in a way that makes its integration a real challenge, although it's feasible, but maybe not in a very timely way. So to answer very basic questions such as, for example, what are the types of public health response to COVID works the best, or even what are the early signals of an outbreak in a given region, for example, we need to address these challenges. And to address these, we have to increase capacity among data providers to apply standards and organize data. We need to address legislative barriers or agreements that are in place that govern data management, that limits its sharing and integration. And we need to mobilize capacity in a secure way to analyze these data. So I'm very sure that we could hold a webinar on each of these topics here. So on the other hand, we're making important headways around creating new ways to get more granular and timely data in the area of labor, social, and economic impact in general. So we're also considering applying our knowledge to making more use of simulations, model, and forecasting methods to measure impact of various re-emergence scenarios as the economy takes off. So that being said, in a context where health data is distributed, there's definitely a need for stronger data stewardship and governance model that would allow for increased data sharing and access. So work is also currently underway to launch a national study of COVID prevalence and contribute to COVID data optimization with public health agency. Therefore, I look forward very much to hear from my colleagues in the panel and participant in this webinar. So thank you, Danielle.
Daniel, you're muted.
Sorry about that. You can hear me now? And I think the presentation ends, but so just was a quick reminder to participants, we are going through the, let's say you could call them opening statements from our panelists now, and we will have a chance for some questions and answers and more interactive sessions a bit later. The next presentation, I think it's advanced to the wrong slide. I'll try to fix that, but just to introduce, it's Miss Angela Foruzza of the Italian National Institute of Statistics. She is the head of Division of Environment, Territory, and Register of Geographic and Territorial Units at ISTAT. She also happens to be the chair of the UNEC Task Force on Measuring Extreme Events and Disasters, which is a international working group, which I've also been following and participating in. So I've witnessed firsthand her clear and steady leadership of that highly relevant work as well. But I think now she will talk specifically about the case of the work that's happening at the Italian National Institute of Statistics. So Angela, if you can hear me, I'll give you the floor and let me try to fix your slide while you...
Yes, thank you very much. Thank you. Good morning, everybody. I would like only to ask you to know before. Thank you very much. And then that's all. Okay, thank you very much, everybody. And in this slides, the first slides, you can see the website of ISTAT, of the National Statistical Institute, where you can see that in the first page, there is a part that is dedicated to COVID. And so please, the next slide. Thank you very much indeed. So I'll try to give you very quickly an idea, thinking that, of course, the National Statistical Institute was involved, if I can synthesize in three different ways. The first one is to produce more specific statistics. The second one is to collaborate with the Ministry of Health and Red Cross to analyze what is going on. And the third one is to try to analyze what will be in the, not only in the actual situation, but also in the midterm and the long term. So just trying to be very quick, you can find more information. You can find more information on the website. So we had a lot of dissemination dedicated to the data, to the special data dissemination. And most of them, of course, were dedicated on male, female, and total deaths per age class in different moments of the situation. So we have a different dedicated dissemination in March, in April, in May, just to give very quickly what is the situation, comparing that period with the period of with the media of the period of the past year. So we have data related to March 2020 compared with the data related to March of the media of March of 5 years, to give an idea of the differences. And this information were also, of course, disseminated for each municipalities. So very, very detailed data. And but we have also a lot of different releases dedicated to also to economic trends, to give what is the situation. So economic trends at the end of March, at the end of April, and at the end of May, to give an idea of what could be the economic, not only the demographic and social impact, but also the economic impact. And also different information dedicated to special aspects like the people aged 75 and older, or the impact of COVID in tourism and the impact of COVID on environmental data. So I mean, very dedicated, short and quick press release on matter that could be related with. The next slide, please. The other point was that, of course, we were involved in a lot of different occasion during the different task forces that worked on this thematic. There was also a Senate art dedicated to this. And so we have had, we were able to work on a social survey dedicated to the days at home during the lockdown. It was a very quick one, and we have already some information on this on our website, but more detailed information will be published, disseminated by the end of the month. We have we had an economic survey dedicated to COVID impact to the Italian enterprises, and this survey is going on, and also in this case we will have the results of this survey by the end of June. And we are going on, we are involved in a special survey dedicated to the population to do serological tests. This is a very important survey. We had the institutional connection with civil protection, Red Cross, Health Agency, and the Ministry of Health. And we gave our input from different point of view. I mean, methodological point of view, the sample survey, for example, and something dedicated also to the survey, the questions, and we gave also information on geographical information related to the subnational territory to give, we gave information, for example, related to the distances among the place where you can do this kind of test and the place where you live. So a lot of geographical data were used, is using in this serological, in this special survey that is going on. And this survey involved the observation of 150 individuals. So, I mean, we can speak more about this also in another part of the panel. And the last point that is dedicated to the necessity to understand what is going on and the process that could be involved also in the midterm, is that we began to try to analyze the connection, the indicators connected to SDGs goal. I only want to show you the next slides, please. Okay, we disseminated the last SDGs report now in May, and in this report we put one example dedicated to the impact of COVID related to the environmental, I mean to this case to the air pollution. But apart from this, that was something very quick. We try to begin to analyze the interrelations among SDGs goals and pandemic. And so you can see in these slides on your right, the kind of conceptual analysis that we try to do considering this, because it could be used for in the next months to analyze the impact in the medium term. And for this reason, we tried also to, we have a system, an SDGs system of indicators. So considering the indicators that we have already in the system, we try to choose some of these indicators to give you the idea that we can use the interrelations among the SDGs indicators and goals in the next future to analyze the impact of social, economic, and environmental impacts of the pandemic. So this is a medium-term analysis that we will do in the next months. Thanks a lot for now.
Thank you very much, Angela. Much appreciated. So we move on now to our next presenter, which is Mr. Isaac Pacheco-Izquierdo, if you can hear me. Mr. Isaac Pacheco-Izquierdo is Management Improvement Director, focusing on socio-demographic statistics at INEGI, that's the International Institute of Statistics and Geography of Mexico. Isaac Pacheco has responsibilities related to implementation of monitoring and management control systems related to socio-demographic statistics at INEGI. He's a specialist in, also has expertise in proactive transparency and public information, and open government, open data, and accountability. So very interesting curriculum vitae there. So I hope you can hear me, because I think there was a technical problem earlier, but if so, the floor is over to you, Isaac.
Thank you very much, Daniel. Yes, I can listen to you. I hope everybody can listen to me too. Well, the National Statistics Office in Mexico is INEGI, and this doesn't concentrate the information from the Ministry of Health or other institutions of the federal or state public administration. Therefore, the INEGI response to the COVID-19 is centered on the statistical products it does generate, such as the population and housing census, sociodemographic surveys, and the generation of statistics from administrative records. In this sense, continuity has been given to statistical projects by means of alternative methodologies of capturing information, and work is being done on the evaluation of the impact on the relevant indicators. Please, could you go to the next slide? Thank you very much. Well, as an extra activity, a COVID-19 viewer has been created, which concentrates information of interest for decision-making on the pandemic, which I will discuss later. Well, something that I would like to say is that about our experience to deal with this pandemic. It has been a challenge to maintain the existing statistics. Some of them have been to be postponed or canceled. In the case of INEGI, two of its main products, ENOE and ENCO, which name in English are the National Occupancy and Employment Survey. This is the ENOE by its initial in Spanish, and the National Survey on Consumer Confidence, ENCO, by its initial in Spanish too. Well, they have been replaced by two new products, are almost the same kind of methodologies, but we have done different changes. Like we have recorded all the information by telephone. It is clear that the data obtained are not strictly comparable with the established indicators due to the different sampling framework and also changes in the methodology, but the aim is to generate qualitative statistics information for both indicators. Could you switch to the next slide, please? In the case of the Telephone Occupancy and Employment Survey, ETOE, well, this measures the impact of the pandemic on the labor market. It yields results such as decreases in labor participation and in the employed population, as well as an increase in labor underemployment. In the case of the second one, that is the Telephone Survey on Consumer Confidence, ETCO, it measures through indicators the degree of satisfaction of the population about their economic situation, their families, and the countries. In this case, we have prepared 15 questions that capture the perception of the economic situation at home and at the country. Neither of the two is comparable, as I have said before, with their predecessors because they have a different methodology and sampling framework. Their predecessors are the National Occupancy and Employment Survey and the National Survey on Consumer Confidence. Please, could you switch to the next slide? And well, I would like to talk about this digital map. It has been developed by INEGI. Its name is Analytical Display for COVID, which through heat maps and the display of information by municipalities permits to carry out several crossings of sociodemographic data, in addition to knowing the availability of essential georeference services. It was designed to facilitate decision-making by both authorities and citizens. You have the digital map on the screen, and the first screen shows a map with the confirmed suspected and negative COVID cases and deaths in a reference way. It is displayed by municipalities. And well, this information was taken from the Mexican Health Minister or department. At the bottom of the screen, you can see also the essential services for which you can get your location. These are the hospitals that treat sick COVID patients, all public and private hospitals, drugstores or pharmacies, supermarkets, banks, all stations, courier or messenger services, and restaurants for home delivery of food. Then a menu is displayed on the upper left side of the screen, in which you can see a list with the sociodemographic and economic statistics that we offer in this digital map. Just to sum up this, well, we show data on population, economic characteristics, health services, housing, hospital infrastructure, social development indices, among others. This is all from me in this first part of the presentation. Thank you.
Thank you very much, Mr. Pacheco-Escudo. Very interesting. Moving on, now we move to Statistics Netherlands. It's Mr. Bartel Braxma, who is the Innovation Manager at Statistics Netherlands, also known as CBS. He works on various projects related to innovation and official statistics, and he's often in close collaboration with both public and private sector partners. And has worked with various international groups related to data-driven innovation and modernization. So, Mr. Brackman, I hope you can hear me, and I pass the floor to you.
Okay. Yeah, thank you, Daniel. I have 4 slides, out of which I will present only 2. The other 2 are for background. First slide is about existing statistics and how we deal with that during the crisis, and the second one is about new things that we tried to do, and that's all about collaboration. So the first slide is about existing statistics. First priority for us was to keep the production running while everybody works from home. Well, there we benefited a lot from investments and innovation we have already done in the past. So our IT to teleworking. Our surveys are based on web surveys mostly, and we have a lot of access to the administrative registers in the Netherlands. So that was relatively smoothly to keep that running. And then already in the beginning of the crisis, we got lots of questions from the Dutch government. So we were also invited to become involved in Dutch crisis management team to see how we could contribute with data related to the crisis. So one thing that we did, is also mentioned by Austria, is to look at in the past we did it on a lower frequency and less time, but we speeded up our production. We're confident to do it with keeping quality to monitor the number of excess deaths. So the government also asked us to evaluate measures that they want to take in the view of for how it affects society. For example, when they wanted to close down street markets, they asked us how many people live on street markets, how many people make their living from that. On the other hand, they also want to know if people have to go to supermarkets, do they have the capacity to cater for that? So that's we were very much involved in checking the measures and how effective they were and what would mean for society. We also looked at our existing statistics. First thing is good that we have them, because that means that we can have a good data-driven view of what's happening. We also speeded up frequency and so on, and the timeliness. So we have now bi-monthly confidence statistics instead of monthly. So we included additional question in our business expectations survey to manage the current crisis. And what's already happening now is that governments thinking about moving back to normal or new normal. There's a government think tank where we also involved in questions about, for example, if you would keep social distancing in public transport, what does that mean? So do depend on public transport. I include the link to our website where you can find information about this. So next slide, please. In addition to the existing statistics, we also try to see what we can do with new sources. So, and here we see that there's real appetite from all kinds of parties that we were already discussing with. They all see in this together. So there's a real desire of people to work with us to see how we can all contribute and make good statistics available. For example, we talk about mobile phone data. This Friday, an emergency law will be discussed in Parliament to make it possible to do that. We use public transport chip cards. We work with banks, payment service providers, market research companies to get a better picture of how people change their payment behavior, if they move from offline shopping to online shopping and so on. We analyze websites. We have created a social media-based indicator about how people feel about the current crisis based on the sentiment expressed on social media. And we also look to the academic and other parties who have knowledge that can use to produce the useful statistics from the data. For example, the social network in the Netherlands, economic networks, which companies depend on each other, which people depend on each other, is very much interested in that. And the next big thing is to think about resilience. So how will people be able to normal from the current situation? So that's what I want to share for now. So thank you for your attention. The next two slides are illustrations and therefore for reference. So I can quickly go through them.
Okay, thank you very much. I think I've said your name incorrectly as well. It's Mr. Bartel Braxma, maybe. That's my best guess. Sorry for mutilating your pronunciation of your name a little bit, but thank you very much for the concise introductory presentation. Last but not least, and again, this is just a matter of alphabetical order, no real reason besides that. But our last presentation comes from the UK, from the Office of National Statistics. This is Miss Frankie Kay, who is Deputy National Statistician of the UK Office of National Statistics. She's leading the use of digital and information technologies, data science, and innovative methods to allow ONS to exploit the opportunities of the data revolution. And she has over 10 years of experience with ONS. So I'm sure a lot of relevant, diverse experience in official statistics is quite relevant to these interesting new questions that we are discussing today. She's currently leading work to establish a cross-government data platform in the UK to facilitate data sharing and access to data. So with that introduction, very brief one, Ms. Frankie Kay, the floor is yours for your presentation, please.
Thank you very much. Thank you very much for inviting us to speak today. It's really interesting to hear what the others panelists have said, and there's some quite a lot of overlap in terms of the work that we're doing. If we could just move to the first slide. Just to say that I'm going to focus on one particular element, which is an infection survey, but just to provide a little bit more context about what we've been doing in the UK. Our work as the NSO has been right at the heart of the response, and we've seen a really big increase use of our stats and data, both in terms of decision makers, but also seeing our information used in our daily press conferences. We've, similar to some other countries, we've spun up weekly surveys, new surveys, both in terms of the social an economic impact on individuals, but also on the impact on businesses as well. We've also looked at providing working with new data sources, so Google Places, aggregated mobile phone, and also spending data, so that we can use that to assess the impact of social distancing, understanding how many people are in self-isolation, and also the changes in goods that people are buying and assessing the impact on business. We've also been using admin data to supplement and replace some surveys. So, for example, we're using employee tax data to provide flash estimates on the labour market. But in terms of the infection study, the overall purpose for this is to understand how many people of different ages across the UK have already had COVID-19. And this is really going to help the government work out how to manage the pandemic going forward, particularly ensuring that we protect the NHS from being overwhelmed. It's a joint study with our Department for Health and Social Care and also academics from the University of Oxford. And it was a 20,000 sample initially in households in England to take part in the first wave. And we used some existing samples from our labour force survey and also the opinion survey that I mentioned earlier. We're ramping this up to over 300,000 households over the next 12 months. And we're going to be moving to more of an address-based sample, more similar to our census. Participants provide samples for nose and throat swabs, and they also answer some short questions during a visit from a health worker. And these tests will then help us identify who's currently got the virus or not. And then we ask people to take part in the tests for every week for the first 5 weeks, and then every month for 12 months after that. And then the results of that data are put in our secure research environment at the ONS so that we can make it accessible to researchers as well. You can move to the next slide. So what we're looking at is looking at the number of infections within the community population. And by this, we mean private households. So it doesn't include hospitals, care homes, or other institutional settings, although we are looking at setting up studies to understand those better as well. So if you think about it in terms of the overall for England, then it could be that the COVID-19 infection rate will be different because it is a community-based survey. So back in the back half of May, we estimated that about 0.1% of the community population had COVID-19. So that's about 53,000 people in England. And we can see that the modelling of this trend is providing evidence that the number of people in England testing has been decreasing in recent weeks. We're finding some interesting findings. Perhaps, as you would expect, individuals working outside the home are showing higher rates of positive tests than those who are working from home. We're also seeing higher rates in patient-facing healthcare workers and resident-facing social care workers as well, again, perhaps as you would expect. And what we're also seeing is that whilst those who have had symptoms are more likely to test positive than those without, we're finding that around 30% of people that report that test positive for COVID haven't reported any evidence of symptoms. So that's quite an interesting finding as well. And we are seeing, as I said, some evidence that the number of people in England that testing positive is decreasing in the recent weeks, which you can see from the chart. So this is just one example. It's something fairly new for us in terms of that type of infection study, but we're finding some really interesting results. And this is definitely for us right at the heart in terms of trying to identify if there are further flare-ups or local outbreaks. This data has been used to identify those quickly, and so that the government can potentially make interventions at a more local level rather than at the countrywide level that we've been doing for now. And that was it. That's all I was going to say for now. Thank you very much.
Thank you very much to you as well. Thank you to all the panelists for the very excellent and concise presentations to get this discussion started. I think now I'm going to try to change back to the holding to our screen and give the floor back to Michael Nanake to lead us into the next session of the seminar here. Michael, can you hear me?
Yeah, thank you very much, Daniel, and thank you very much to the panelists. We have received some questions through the chat. We will come back to this. I just recall the questions that we received. One was about, do we have to be concerned about the quality of statistics when everything has to be sped up now? And there were also specific questions to Frankie, who conducts the infection survey pilot, your office or health ministry, and also does ONS to have a measure to false negative test results. I propose we come back to this when we discuss the statistics and indicators needed, but maybe you can use the time in the meantime to think about this. Can I ask Stella to put online the next poll that we have, the next question that we have to the audience, question number 2. And while my colleague is doing this, I just would like to conclude what has been said and what has been presented. So I think what we can see is from all the presentations, what NSOs have in common is that they are confronted with new type of questions. Collaboration is key. I think this also came from all the presentations. There is a need to increase the speed of producing and publishing results, also to make existing statistics fit for purpose. So not to reinvent the wheel, but to use existing statistics, but maybe to change them a bit, to make them really fit, and also to change the way of dissemination, to fit it to the policy information needs and not to information needs of the general public. I think there's lots of things in common. So I think it's a good idea to have the next session of this discussion about the role of the NSO in managing this pandemic, which has been addressed partly already in the presentations. We would like to start with this question to everybody, so you can go back to your voting tool, and many have already started. And the question is simply, what do you think are the priority actions of NSOs in helping to manage this disaster? If you don't have an opinion, please click skip, because otherwise it would be rated as 1. We can continue with that, and the idea is now that I ask a few questions to our panelists. These are questions that we have taken from the registration process, and I would like to ask the panelists to share their thoughts about these questions. And I would start with Matea from Statistics Austria, if that's fine. And if she could share with us what she thinks about really what are the most important activities of Statistics Austria for supporting the management of this disaster, and also maybe to say a few words about, according to your experience, are the existing institutional arrangements sufficient? You mentioned a lot about collaboration, Red Cross, I recall, for example. So maybe you can share with us which challenges did you face and how did you overcome them, if there were any challenges. So Matea, please.
Yeah, there were a lot of challenges. I think the whole weeks were just one big challenge. We were all currently working from home, so the collaboration was at the beginning a little bit complicated because your colleagues are not there, you don't have the usual meetings. We didn't have WebEx in that way that we could use it very fast and very good. So at the beginning, we used WhatsApp or whatever, so just to try to communicate together, and it needed some days to fix everything on the IT basis. And but what was really fascinating for this project, for this COVID-19 prevalence study, that I was able to choose people with I like to work together with. So I could choose from the whole Statistics Austria department people to work together, and we did choose experts from each part of Statistics Austria, and this was really good. And it was, I think, it's rather new for Statistics Austria to work not only in your organization or in your department, but with everyone who is an expert. And this was really good. And also the work together with the Red Cross or with the ministry or with the University of Vienna, everybody was under stress, and for everybody, everything was new. So we didn't ever before conduct a study where we did have to work together with the Red Cross, and they have a whole completely different kind of organization than we do. And they also they work differently with data, and if you work together with them, which is usual for us to send them some data and this will work, it doesn't work for them. So kind of you have also to have a lot of technical skills, but also a lot of social skills, because collaboration is different than I was used to with colleagues from Statistics Austria. So yeah, and there were a lot of calls, a lot of conferences, a lot of meetings, and I think that on the one hand, it was really hard that we to accomplish everything, but on the other hand, if we didn't have the possibility to work from home, I didn't think it would work like that. So I think coronavirus was the problem, one kind, but it was also the solution, because the kind of new work which we had at Statistics Austria was really good for this project, and it wouldn't work otherwise, I think.
Thank you. So you used the challenge as an opportunity to go forward also in terms of collaboration with others. I think this is what many of us actually experienced. What was a challenge became suddenly an opportunity and a new way of collaborating. Thank you for this. If I can ask Canada, so what do you think is the most Canada has been doing management, and what is your experience in terms of collaboration and institutional arrangements?
Thank you, Michael, for your question. That's a very tough question to answer. In fact, I think that the first role of a statistical agency is to, first of all, to keep doing what they do best. But this is not enough. In a situation like this, we need to strive to do new, innovative ways and everything, because when it comes to evaluate the midterm and long-term impacts on the society and on the economy, for sure we are going to be there because we have all the tools to measure this. But now the need for information is right now, and there's a need for creating information in a way that we can even project or do forecasting. So I would say that one of the important role we had to fulfill as an NSO was to create some flash estimates to measure what the impact on the economy is, and leverage all of our capacity in micro simulation to use supply and use tables. This is the input-output tables to measure shock in specific industry of the confinement on the overall economy, and also to have measure of social policy simulation that we can do. So those were very important to put forward some information about what are the immediate impact and midterm impact on the economy. We even ventured, I think, launching some crowdsourcing surveys, which is not something we normally do, and some people may criticize that these type of vehicles don't necessarily provide the expected quality of information that is expected from a national statistical agency. And they're right to think that way and to be concerned about this. But I think that by doing this, we, however, produce very relevant information. I think it needs to be packaged in a way that people understand the limitations of these tools. However, we know that journalists, when they present those results, they don't necessarily make those important distinction between what is an official statistics and what is a signal we can measure from the population. So we've been doing methodological studies, because on some of the crowdsourcing surveys we did, we got more than 250,000 responses from the Canadian population. But that doesn't mean that the results are unbiased, because the more response you get, the more solid biased results you may get. So, and we need to do some studies around that, and we're not done. We're not sure if we produce, but nonetheless, most people thought they were useful information. But I would say that in time of a crisis like this, it might be an important way to provide some early signals of the issues. But I would say not abuse these type of tools in normal times, because this could impact the trust people have in the National Statistical Agency. So I would stop it there. I think that most of the challenge we had is in how the data is organized in the health area, because it's very fragmented, like I said in my presentation, contrary to social, labor, and economic statistics, which is very much centralized here in Canada. But when it comes to health, it's a distributed data model. And there's a lot of challenges trying to put that together. And like they did in the UK, use a common space to allow researchers to integrate and analyze these data in a comprehensive manner. Thank you.
It's very interesting listening. Basically, you were saying the NSO was doing what the NSO is good at, but it was triggered a lot of innovation actually, and it challenged also a little bit the way of traditional production of statistics, and you had to keep the balance still to be trustworthy at the same time. So not to deviate too much from the way how NSOs and official statistics are usually perceived, but at the same time being becoming more innovative and addressing those issues that were really asked for. Thank you for this. I continue to Angela. So what do you think? The most important role that ISTAT was playing in that regard, and the challenges regarding institutional collaboration and setup.
Hello. I mean that challenge that became opportunities. It is always one of my favorite phrases in general, and it was also in this case from different point of view. You have to know that we began to work in remote way just the first days of March as experimental organization point in National Statistical Institute. And after a week, it depends the normal way of working because of pandemic. We have begun as an experimental way, and it began the normality, and it is the normality at the moment, and I suppose it will be for a long period. But apart from the first week in which, of course, I have to organize the work of my colleagues from a lot of point of view, personal computer connection and very basic questions, I found that it was a very, very interesting process. All of us are, I have the feeling that all of us worked better. I mean, we have a lot of web meeting, but they are concise and precise. I mean, 1 hour meeting, we began and finish. We know what are the questions and what are the problems, and then we find the solution in a very quick way. And I found a lot of collaboration from all the people that worked with me. It was very important from this point of view. All the people really collaborated with me in a very nice and interesting way. And this happens also in the directors meeting. I mean, it wasn't only a small group, but it happens in the National Statistical Institute, and this is the first point. We had also a very interesting collaboration with the institutions, and we have this, and I'll tell you more. And again, from the National Statistical point of view, it was interesting to face with the necessity to produce in a very quick way statistics and
at least I have lost Angela. Daniel, can you confirm that Angela connected, or is it just on my end?
Yes.
Okay.
She's back.
Now I see you again. And there was also this kind of collaboration with this institution, I mean, the Ministry of Health and the Red Cross. And as I told you before, for example, for this sample survey, we are using geographical data. I have the territorial units also, and we produce, my colleagues produced for Red Cross the distances among the place where people has to do the exam, the viral exam, and the place where they live. And so these colleagues worked during the weekend every day to produce this information, this geographical information, to give to Red Cross to do better the survey. Of course, we have to face with the fact that we will continue to work in this way next month. And so the midterm could be, again, a challenge. I don't know, because we don't know when and how. We are in the mixed phase in which we can go into the office, but only for special occasion, for something very special. We have the doctor that has to say us if yes or not. And I mean, there will be organizational thematic in the midterm that are not solved. And the other point is that it was again a way to show and to work with my colleagues in an integrated way, considering together social, economic, and environmental data together. And this is very important. I mean, this is important in general, but of course, in this occasion was a lot more important. Thanks a lot.
Thank you very much, Angela. I think you also somehow confirming that this buzzword, the new normal to which we are going to return, is not necessarily worse than it was before, at least from the perspective of collaboration within the institution and with institutions. Thank you very much for this. Next on my list is Isaac from INEGI, please.
Well, thank you. About the priority actions that we have taken, first of all, I would like to say that we have had to establish additional dissemination channels. In the case of INEGI, communication channels were established with health authorities to provide databases of hospitals in all country, hospitals infrastructure, also a database with the population age 60 years or more, and risk groups. I mean the disaggregation of the population with obesity, previous diagnosis of hypertension, diabetes, and overweight. This data from the year 2019. I think that these new dissemination channels have helped our government. As you know, these are diseases that have been shown to cause increased mortality when people are infected with COVID. That's why it is useful for the health authorities. Also, well, another priority that we have, another priority action that we have taken is adapting existing statistics. As I mentioned before, it was a challenge to be able to maintain the existing statistics, some of which have had to be postponed or canceled. In the case of us, as I told you before, we have to continue with a new exercise of the National Occupancy and Employment Survey and the National Survey of Consumer Confidence, and we replace them with telephone surveys. Another action priority was to start with new analytical work. Through the use of derived statistics, INEGI disaggregates municipal information from state information. In this case, we have worked with or for labor and health statistics. Another priority action could be, well, the increasing our delivery times. The punctuality and timing with which indicators are being published is being affected. For example, the publication of census result was tracked over several months. Also, statistics from administrative records, which can shed light on the impact of COVID, are slow according to current processes and may take even longer due to the closure of reporting units, like local governments. Well, also some surveys have been canceled due to the impediment of conducting face-to-face interviews, while others have been adapted to new methodologies, but prevented from being compared with previous projects due to the differences in sample size and representativeness. We also have created new products. As I explained before, we designed and made available to the public the analytical visualizer for COVID-19, a tool to assist in decision-making by geography, locating the number of confirmed cases and deaths by COVID-19 with additional information. And it has been a challenge for us communicate and disseminate these new products. We have carried out dissemination campaigns, how to promote the self-registration of the population and housing censuses, as well as to disseminate new statistics products such as the telephone occupancy and employment survey and the COVID-19 viewer. It has been very important for us to disseminate this kind of products, because if we don't communicate to the public, they won't participate. And finally, we have the establishment of new data collection. I want to add that we are just starting the formulation of a telephonic survey on COVID-19 and the labor market. And in this, which will offer additional information on the impact of COVID-19 on the labor market. And these are the priorities that we are acting on. Thank you.
Thank you very much, Isaac. Many questions are coming through the chat. We will not be able to address all of them during the discussion, because we're also running a bit late. If I can ask panelists if they see questions that are dedicated to them or where they can respond, maybe you can answer them in the chat. And in any case, we are collecting these questions and we will try to find an answer or response after the event. Okay, so if we cannot reply to them, we will collect them and we will discuss them with the panelists also after the event, if that's okay for the panelists. So because we will not be able to reply to all of them. Having said this, I continue to Bartelt from Studies in Netherlands, please.
Yeah, thank you, Michael. I will not reiterate what the others have already said. Yeah, we observe many of the same things. One priority for us has been from the start to do the right things and to do the things right. So keep up quality standards and so on, and to make sure that we address the questions that are most relevant for policymakers and government and so on. So one thing that I want to emphasize right now is in the area of institutional arrangements. So especially in Europe, already a lot of action has been taken to make sure that public data collected by government, statistical institutes, and so is made available to everybody, including the private sector. So we do as good a job as possible as we can there, I think. So what we have already emphasized for years is that we also need the access to privately held data if you want to do our job in the best possible way, in the public interest. And that becomes very important right now. I mentioned some examples of mobile phone data and other data sources, financial transactions data, electronic payments, and so on. So what we see now is that there's a lot of appetite from all kinds of parties, mobile network operators, banks, and payment service providers, so to collaborate with us. But the institutional arrangements are not there. So that means that we have to negotiate every time again. So how can we make this possible? How can we do this in a good way, observing privacy and so on, the confidentiality issues in the best possible way? So I hope that what we see now is is a kind of wake-up call for everybody to see that if you want to serve society with statistics in the best possible way, we need to improve that situation. So that's one thing. Further on, I also want to echo what Ivan said about the health data situation. We observe the same in the Netherlands. So the health the system is fragmented where it comes to data. There's a reason for that, because it's very sensitive data, but also here there's some institutional barriers that could be improved. So I think we should also think about that. And health is just an example because of the current crisis. I think that in other areas we also have to think about so how can we make sure that the society as a whole can benefit in the best possible way from the data that is available. How can we organize that, and especially which role we can play there as statistical officers, as data stewards, data hubs, and whatever. Okay, thank you.
Thank you very much, Bartel. Yes, I also think that this issue of health data in collaboration with health authorities and NSOs is a specific topic in itself. But thanks for also highlighting this. I turn to Frankie from UK. So what do you think about the most important activities of ONS and challenges related to international collaboration?
So in terms of, I think the priorities for us, it was sort of timeliness of data was key. Hence, and it was interesting that we did use some administrative data very quickly. So we did look at, for example, when it first broke in China, we were looking at flight data to understand actually what was happening in terms of, and also shipping data, what was happening around sort of China. So we did use some of that data, and that was done within a weekend. So that was done really, really quickly. But in terms of understanding the broader sort of socio and economic trend, we did end up turning to surveys. So we did set up a weekly social survey and a weekly business survey, both of which are still running. And we have an ability to vary the questions for both of those surveys. So we do answer slightly different questions. So that was a big priority. But also for us was a big priority was actually being able to link data from different sources. So in the UK, the ONS does have the powers to get hold of data from other government departments, including health data. So we have an ability to get access to that data, and then but we can link it then. So we've linked it to census, we've linked it to occupation codes, and to try and understand what's happening within for the COVID situation. It still hasn't been very easy to do that. So although we have the legal power to do it, the practicalities of actually getting access are still quite a challenge. And we've also looked in terms of sort of the lower geographical breakdown, understanding weekly deaths, excess deaths as well. Interestingly now, there's turning to quite a focus now in understanding the impact of loosening the restrictions and seeing how the economy and actually turning to understand what's happening to the economy and how that might recover. In terms of the challenges, some similar ones, we too turned to working at home very quickly within a week. But I think what's interesting now is that the volume of work and the pace is beginning to impact our staff. So there's a real well-being concern, really making sure our staff are looked after. They're not isolated, they're not lonely, and we're seeing some instances of that. So I think that's something that I think we all have to be mindful of. Other challenges where I think similar to others, you don't have a field force, so we've had to move surveys online. Our response rates are dropping as a result of that. But the positive, which is very similar to Italy, is that we've been wanting to make a whole bunch of changes, and this has absolutely accelerated that. So we want to move from a paper-based, face-to-face labour force market to an online survey, and we've had to do that, and we don't intend to go backwards. So it's it's one of those things. It's obviously a tragic situation, but it has allowed us to make some changes at much more rapid pace than we would have otherwise.
Thank you. What you're saying is also that usually innovation that takes time, new ways of working to be rolled out over many, many years suddenly happens within weeks. That's very interesting to hear. Since we are running a bit late in time, I propose the following, that we have one final round in this session discussing more the role of the NSO collaboration. But I would like to ask the panelists maybe to pick one question that they received through the registration process, or maybe one question that came through the chat, and to respond to this. And maybe at the same time, Stella can put up the results of this Mentimeter poll that we did. So just that we see, and if panelists would like to react on that, this is also an opportunity. But I would now raise the question, or ask the question again to the panelists. Is there one question that came through the chat now, or that you have registration process you would like to respond to? And if that's okay, I would simply change the order now and start with Frankie, who was the latest speaker, if there is a specific question she would like.
Okay, just to answer one of the questions on the chat, in terms of the infection study, we did use private companies. There's a company called IQVIA to conduct the study, and also the National Biocentre as well. So we didn't conduct the survey ourselves, we outsourced that. But in terms of perhaps one question I was just rapidly looking through, I think there was something around, have fundamental principles of official statistics been challenged, e.g. confidentiality, and how was this addressed? And I think one of the focuses that we've made is how do we, I suppose, speed up the process. So we absolutely want to maintain confidentiality and privacy. Those are incredibly important, and we want to make sure that we make ethical use of the data. So what we did in the UK was look, how can we make those processes much quicker? So we kept the fundamental principles, but we did make that process in terms of getting approval for research projects around ethics much quicker. And one of the other things I think I've noticed that, or we've noticed, is that our data has been used more in almost in a management information type way, so more around operational decisions. So a lot of our data is feeding into dashboards, and it's that rapid need for decision making. And how do you get that right in terms of publication schedules and practice? So when you're providing that kind of operational data or analysis on operational data into government to make decisions, how does that balance against the need for publication and transparency? And that's something, again, I think that we're finding quite challenging, just to make sure that we get that balance right. And there's been a couple of moments where we've rapidly had to get data out because a minister is going to talk about it in public that we hadn't realised. So that's been quite interesting. And I think for us, what we've tried, the most important thing is about being transparent and open, both in terms of if there are any caveats around the quality of data, and being very clear about what data we're using and how we're using it, making sure that everybody understands that it's anonymous, that we're maintaining privacy. So I think they've been pushed, those fundamental principles, a bit, but not to an extent that we feel that they've really not been able to be fit for purpose and serve the need. So that would be that was the one that caught my eye.
Yeah, thank you very much, Frank. Yeah, I think that's a very important question. I think we will come back to this much more often. So how has statistical confidentiality been challenged in this situation? If I may ask Bartelt, is there one specific question you would like to reply to?
Yeah, thank you. There's, in the chat, there was a question from Siti Zakia from Malaysia, who asks, is there any countries plan to conduct a survey on post-COVID-19 related to the economic situation? So two things I would like to say about that. On the one hand, in our current surveys, we include questions about how companies think about their future. When we asked that about a month ago, half of the companies were afraid that they would not survive the crisis. When we asked that now, they're a bit more optimistic. There's only 10-15% of the companies who think that they will not survive the crisis, which is an indication that the government measures to support companies help. So that's kind of questions that we include in our current surveys. And there's more than that. So the answer is yes, we try to do that. We also try to give an indication how many companies profit from the subsidies, the specific measures that are put in place by government. And we're thinking beyond the crisis right now. So we try to help government with a natural question that you can ask about how many people will keep on buying stuff online instead of going shopping to a brick and mortar shop. What will systematically change in the behavior of people? So we already try to think ahead of what kind of questions will be asked by government. Some of them have been articulated. In other cases, we help them to articulate the questions. And we also then help them think about what kind of evidence we could supply to support that. So I think there's two roles for us here. On the one hand, we have to listen what are the questions. On the other hand, we also can be proactive on saying, well, and we can be assertive as well. We have a duty in society, so we can do that in a very good way with all the background and the experience that we have. So we can approach people. So, hey, we can help you when we think this is the best way to do it.
Isaac Pacheco, is there one question you would like to reply to? You're muted.
Well, thank you. Well, I had a question from Itzel Sanchez, and it was about, well, the differences between the new surveys that we are doing and the previous one. And well, I would like to say that we did our best to have high quality data. Due to differences in methodology, we recommend taking the data with reserve. It is specified that the data of these telephone surveys cannot be methodologically a continuity of the previous surveys delivered. Because, well, the other ones, or the first one, were national surveys, and these are just telephone surveys. And actually, we are using a subsample of the population that we used in the previous ones. So they have just reference purposes to give continuity and to understand what is happening with this pandemic now in Mexico. That's all from me.
Thank you very much. And Angela, is there one specific question you would like to reply to, coming from the chat or from the research station?
I tried to answer also writing, but there was a question related to special dissemination. I told you there are many special dissemination in that website. And as far as the special survey, yes, I told you there was this special survey dedicated to the population to do serological tests. I want to tell you that the aim of this investigation is to understand how many people have developed coronavirus antibodies. And so it was even in the absence of symptoms. It is a very specific, of course, and it was organized by the Ministry of Health and by the Health Agency, and we gave them our methodological support. The other point is that we are conducting economic survey dedicated to the COVID, and to the Italian enterprise, and we are asking questions on economy, occupation, and finance. Which actions for the phase 2, which provision for the next impact, and the results will be disseminated quite soon. And as I showed before, yes, we are working in the national statistical analysis regarding SDGs indicators, exactly to understand if SDGs indicators could be helpful to analyze the impact COVID and to consider again the integrated approach among the different domains for the medium terms.
Thank you, Angela. Ivan, is there specific you would like to reply?
Yes, Michael. There was a question being asked about how NSOs will improve their response in view of the next crisis or work in the future. And I think that, first of all, we need to identify what are the barriers or issues we were facing, because in time of crisis, and everybody knows that, is all the challenges we're facing in normal time are just being magnified when a crisis occurs. And the only issue is that when the crisis occur, we don't have the time to address those issues, and we need to be effective. It's like participating to an Olympic performance. You have to train to be good. So I think that identifying barriers is probably the best start. But the thing is that we also are able to show where we're good, but I think we now have to take advantage of the momentum that there is now to raise issues with central agencies and work with them on solutions to tackle issues we could have about legal barriers surrounding data sharing, or other capacity issues we could have at the collection front, or any things that prevents us from sharing information and working more efficiently. And luckily, I think that central agencies now do have an interest in addressing those issues. We hope that the interest will be sustained, because the time it will take to solve some of these issues will probably be much longer than the interest time, or the time the interest is going to be sustained. So there's this challenge we have to meet at the same time. So, but I think we have to identify where we can have quick wins, and the solution will vary by country as we face different legislative landscape, different organizational structure, and all NSOs are structured differently. Some are very centralized, others are not. So we all going to find, and every NSO knows what their challenges are. And I think that this is the most important thing. One way we believe we could resolve some of these problems is to create what we call much more stronger data stewardship function within an NSO. And we can certainly play a bigger role in data stewardship. And COVID-19 presents to us as a use case for doing so, and building collaborative space, and show the world that at least in Canada, that creating a safe space where we could manage by StatScan to host information and facilitate access to data, while providing as a very solid framework for the use of standards. So I think that we think this is a way to go, and we see that as an opportunity to go there. But every time there's a crisis, there are going to be recommendations. And if they're not being tackled, when you get to the next crisis, you're still going to be facing the same issues. But this time, I think that the landscape is a bit different, and I hope it's going to play to the advantage of NSO to improve their strength.
Excellent. Great. Thank you very much, Ivan. And Mattea, is there a specific question you would like to reply to?
A lot was already said before. I think what is another important thing here is that we also did see that how Statistics Austria is viewed in the population did change a lot. On the one hand, we had people who wanted to have data at the same moment or one day later, and we did have the challenge to produce data very timely. On the other hand, within the surveys, we had people who were very afraid to give us their data, because, for example, this survey, the COVID-19 survey, they were really afraid that we are taking health data of them and sharing it with the government. And we got a lot of emails, and people were kind of, they wanted to help, and they also wanted to share the data, but they didn't know what is happening. And so we did set up a whole communication strategy to communicate with people and to take their fears. And also, on the one hand, it was very important to make clear what are we doing with your data, and with whom we are sharing your data, and in what kind. And I think this was the first items on our questionnaire were information about legal rights of the person. And on the one hand, it was very important because people feel secured. But on the other hand, we get a lot of calls, and people are telling us, oh, I can't say yes to all of those questions, but I would like to participate. And so I think that also this crisis changed how we should communicate with the population outside. And it was really tough for us, because we want to have the data, but on the other hand, people are afraid even if they want to share the data. So I think communication is also very important.
Thank you very much, Mattea. So I think, in short, what you're saying here is also this transparency that's very important to keep the public trust. And I think it saying that getting out of the new but be careful because official statistics is really trusted, and this should not be really challenged. Having said this, I have unfortunately closed this session here. We are very, very late, and the discussion is very, very interesting. This is also for me an indication that maybe we should find a way to continue or to repeat this kind of event. And as I said, we try to answer all the questions here with the help of the panelists later on in writing, and so that also these very technical questions can be answered. I would like to hand over now to Daniel to moderate the session on statistics and indicators needed. So this first part was more about the collaboration, and now it's more like really about the substance. What should be produced, what's expected, and what are the related challenges. The idea was to start again with a short live poll. So Stella, you could put it online, but without further delay, I think we should start this discussion here because of the time constraints that we have. So Daniel, up to you.
Thank you very much, Mikhail. So yeah, just to clarify for the participants online, feel free to go back to the Menti and start filling in your responses for the final poll questions. If we have time, we can have all the participants in the panel sort of react to your responses to the poll at the end of this discussion. So shifting gears a bit for this session, I want to, maybe in the interest of time, pose a bit of shift gears with something of a two-part question, which I think maybe be a bit more efficient and also help us to react to some of the questions from the chat. There are a lot of questions in the chat, and I think some very interesting questions, some maybe too many to get through, but I want to try to pose a question that may get into some reactions to some of those questions, at least in a general way. And the purpose of this session is really to shift gears a bit from discussing some of the processes and our data sources and the role of NSOs more to the outputs. So the outputs, what specifically are the statistics or indicators that were the designed outputs from the various new data sources and processes we've discussed so far. So I'd like we'll go through the panel again, and I'd like to ask each panel to come up with one or two examples as you like, to really just specifying what was the output in terms of new statistics and new indicators, new demand for new statistics that came as a result of the COVID-19, and who was demanding these statistics. And the second part of the question is if you could also say something about that example, about that new statistics or new indicator in terms of the quality challenges. As we've talked a lot already about the issue of confidentiality, the timeliness was identified in the last poll as the key challenge. The timeliness versus accuracy was a question that came up in the chat a lot, or whether it's about coverage, whether you're able to capture a good coverage for this specific new statistics or new indicator that you want to use as an example. So if you could talk about that. So again, I would ask you just to identify the new statistics or new indicator, whoever is demanding that from your office, and what are the core sort of statistical quality criteria challenges, whether that statistic is produced from a new data source or adapted from an existing data source. So I start again with Matea Pasvan from Statistics Austria. I'm not sure if you want to talk specifically about your COVID-19 prevalence survey. You could use a different example if you want, but what were the specifically, for the benefit of the audience here, the indicators, and what would you say are the key sort of quality challenges in order to meet the demand of your users for those specific indicators from the survey? Over to you, Matea.
As I'm the project leader of COVID-19, I have to talk about that study. I think the Ministry of Health and the Ministry of Education and Research asked us to estimate the number of infected people in Austria. And what was here challenging for us is that we see at the moment there are many people, or not as many as in other countries, but for Austria, many people infected. People wanted to participate within the study. But for the second study, which we already did conduct, the amount of infected people decreased. So in Austrian newspapers, there was written, communities in Austria, there are no infected people. And what we see now is that people are not anymore or any longer interested to participate within the study because there is no problem anymore. So there are not many infected people, and so there is no need to participate. And what we also did see that when we provide people the antibody test, the amount of people who are willing to participate is completely different because many people think that they were infected or that they are infected. And so if they have the antibody test, they are going to participate within the study. And this is also, I think, a challenge for future, or at least for us, for future COVID-19 studies. How can we engage, or how can people be engaged that they participate within our studies? Because if we only get 30% of the gross sample, it's always a question, who do you get? And are you getting the ones you, so even if you can estimate everything, but you want to get at least 50, 60%. And we see from survey to survey that the numbers of people participating is decreasing. And even if we didn't have, we used Kavi for this survey, and we were really happy that we did install Kavi already, but for other surveys, because if we didn't have Kavi, there would not be no possibility to conduct such a survey. So yeah, I think that the challenge, or maybe for us, or maybe also for others, is how can we provide constant good data and engage people to participate within our surveys.
Okay, thank you. Very interesting. So basically, the indicator is the rate of of the infections or for the antibodies, and the challenge, it seems like this has to do with this getting a good response rate, a good coverage from the respondents, and especially if we want these statistics as a time series, and that the response, the quality of the response is changing over time, then that becomes a serious challenge. I don't know what the answer is, but that's very interesting to think about. So thank you for that. Moving to Yvonne Claremont from Statistics Canada. You talked a lot in your presentation about new sources of data, and you mentioned some work on nowcasting. There was a question in the chat about that as well, about the quality of nowcasting. I don't know if you want to talk about some of the modernization efforts that have been sort of boosted during this period, or new sources of data or not. But again, the general question is, if you could identify one or more new indicator, a new demand that was created due to COVID-19, and what are the quality related or statistical quality related challenge, the main challenge for that specific indicator, please? Over to you.
Thank you, Danielle, for the question. I think that there's, I will leave aside the demand for more granular information on pertaining to public health. And we all know there's a kind of an arbitration government needs to do between public health, social cohesion, and the economic recovery on one side, which are all going to have a tremendous pressure on public finance going forward. So you can think that there's tremendous demands for new information. And I could think, for example, information or requests that are coming from central agencies, Department of Finance, or several other key departments in the federal government here in Canada, is information on about simulating the social and economic impacts of various re-emergence or deconfinement scenarios. What is this going to lead us to? Or there's also requests for more information on gig workers, as labor force is turning to be an asset to becoming a liability for private enterprise. And in this notion, there is a belief that gig economy and gig workers is going to become more prevalent after the crisis. So there's a need to refine our measures in there. Also on intangible capital, the business surveys, entry and exits by industry, lots of demand for information on that. And evidently, a lot of information requests regarding post-secondary education and delivery mode and how this is going to be in September. September is a big date. After summer's passed, people will want to know how we are going to be affected in all these domains. especially that there's a high share of foreign students here in Canada, and they account for big revenues for universities and colleges. So there is a worry that this is going to have an impact on foreign student attendance in PSC institutions in Canada, and that revenues are going to go down, and quality of graduates as well. So these are all questions we have. But more recently, we got requests from Association of the 22 biggest municipalities in Canada who are asking for much more granular data at the community level, which NSOs sometimes struggle very much providing information at a very granular level for smaller geography. So which is bringing us into rethinking how we're producing our sampling plan for certain surveys, for example, the labor force, and also making more use of small area estimates to determine and provide these estimations and data. So those are all things we are getting pressures on. So I would leave it there, but in terms of new methods, it's really nowcasting it's something that we have started to study a while ago, but we were always afraid to go on and release information based on these new methods. We wanted to analyze them and everything, but this was the perfect context to say, well, listen, it's not perfect, but here it is, and the way we are going to package this is, that those are estimates. And forecasting, we're not there yet, but it's something we're considering, because sometimes the finance department is doing that, the Bank of Canada is doing that. So why should we do it? So there's a challenge about delimiting our responsibility and roles with others. So I would leave it there and leave it for questions if there are any questions.
Okay, thank you, Ivan. Very interesting. Yeah, there's a huge demand from policymakers to understand how the economy is going to be affected, education, and these are evolving demands, because we still don't know what's happening in the next stage, and I think that's something that all statistics officers are facing. So I think more discussion on that topic is definitely needed. Angela, Farusa, I'm passing it to you. The same question. We're trying to just sort of identify, for the sake of sort of zooming in on our problem here, specific indicators or new statistics so new demands that have arisen in response to COVID-19. I did note that there was a question in the chat about environmental impacts, whether there's any study about the relationship with the environmental impacts in COVID-19. And you had mentioned just very quickly in your presentation about air pollution. So I'm not sure if you want to elaborate on that, the indicator there, or another example. It's up to you as according to your preference. But if you could give an example and then talk about the quality challenges.
Yes, I'm very interested on the fact that I could repeat quite every word that my colleagues in the National Statistical Organization have told before me. So, I mean, we have more or less the same problems. I don't want to repeat them. Yes, we have done, we try to do something related to the first impact on environmental air pollution. So we did this, and we put this first analysis on SDGs report. We have in our program to work more on this, considering also working together with Italian Environmental Agency to understand better what is the situation on this point of view, from this point of view. So we'll do this also because we work together with them on SDGs, so it could be useful also from this point of view again, this framework. And I like to use this minutes that I have also to instead to speak about the fact that we had during this period the necessity to work on, for example, mobile phone data to understand better what is going on. mobile phone data to understand what is going on and to do this kind of analysis. And then in the National Statistical Institute, we have also some experiences from the methodological point of view on this, because me and other colleagues tried already something related to earthquakes, and we would like to try this in this situation. But of course, we have again the problem of confidentiality, and this is a big problem. I mean, one of the points that I would like to raise to all the colleagues is this. I mean, we had the necessity to use this data to do statistics and to provide information that could be quickly useful for the population that was asked to us. But we had the methods because we tried on some small amount of data when we have earthquakes. We couldn't use it, and this is again, and there was a bit of debate on this, and I think it could be useful to use also this occasion to put again this thematic on the table, because of course confidentiality is one of the most important things. I'm really persuaded on this, but I mean, the balance among the confidentiality and the necessity to do statistics, only statistics, of course. I mean, this could be a point, in my opinion, to discuss in the next meeting. Thanks a lot.
Okay, thank you, Angela. So we have a proposal for a follow-up event. I think that this is a common issue. It's interesting how this disaster has created new attention and new opportunities for these new data sources. But yes, again, the issue of confidentiality may be a heavy issue for further discussion at the next event. Let's hope. From the perspective of Mexico, I'd like to turn again to Mr. Isaac Izquierdo. If you could talk a little bit about new demands for new statistics or new indicators created from this disaster. You had talked in your presentation about a lot of extra activity going on at INEGI. I was also very interested in your analytical display. The geographic integration of all of these different statistics is very interesting, but what types of indicators, specifically new indicators, if you could give an example or two, are being produced from this work, and what are some of the challenges you're facing with these new demands?
Thank you, Daniel. Well, due to the need to have indicators of the impact on the economy, INEGI decided to carry out telephone surveys trying to maintain the NOE methodology, knowing that it would not be of the same quality, but always with the idea of keeping the general public informed, but above all, the decision makers. As for the pandemic itself, it has not been easy for INEGI to help more, since the data is provided by the Ministry of Health, especially, well, the health condition information. We are in the most difficult part of the pandemic, so getting the data is, well, as quickly as it is needed is not always possible. But well, talking about our analytical tool, we have tried to collect different sociodemographic information and statistics and propose it to the public. Some of the main statistics that we show are the risk diseases with the state disaggregation of the population with obesity, previous diagnosis of hypertension, diabetes, and overweight. Here we show population age 20 and over and population age 60 or more years. This data from 2019. And also we show the deaths due to various conditions in the year 2018. In this part, we showed municipal disaggregation of deaths rate for every 10,000 inhabitants in 2018 due to pneumonia, influenza, heart diseases, diabetes, hypertensive diseases, and chronic respiratory diseases. And well, I would like to talk about some of the challenges that we have faced doing our work. We have faced difficult working conditions because of the confinement, you know. This especially has impacted the interviewers and the pollsters. working at home impedes field work, the face-to-face interviews that were the fundamental basis of the methodology for several statistical products, such as the census and various surveys, replacing this has to be, well, this hasn't been easy. We have had to redesign the face-to-face data collection methods. And in the capacity to generate statistical information, we have had to do those changes. However, reality is imposing hard lessons that will lead the national statistics offices to a methodological metamorphosis. For example, in Mexico, surveys, as I told you before, related to occupation and employment, have been changed. Also new methodological designs should incorporate changes in sample size. The initial trend seems to be toward reducing them. However, the biggest challenge will be the success of the contact with the target population, the basis of the data collection. And this will require integrating social and technological factors along with features that resemble advertising campaigns and consumer services to attract and keep participants in the sample. Not only will it be necessary that, but also to create contact directories with updated personal data. It will also be vital to incorporate ways of generating credibility and trust based on elements such as the reputation or social acceptance of the NGOs and mechanisms that allow the public to detect and discard apocryphal data collection campaigns. That is a problem that we face in Mexico. Thank you.
Thank you very much. I'm very interested in this compiling this historical data for the purpose of risk assessment of the risk population. This is I think something that we can learn from, since no one had anticipated this pandemic in advance. So the challenges in compiling this historical data unexpectedly like this is, I think, very interesting opportunity to learn from. Mr. Bartel de Brexma, I don't want to skip any of our panelists, but I'm going to try to speed this up a little bit. You mentioned, I was intrigued from your presentation, you mentioned that the government had been asking a lot of new questions from your office, result from the COVID-19, and you gave very quickly the example of the closing supermarkets, and they wanted to sort of plan or have some more information about how that was going to how that would affect the local economy, and I guess the effects of the social isolation. So I wondered if you wanted to elaborate on that point a little bit. So the new demands that were asked of you from your users within the government to produce a new statistic or new indicator. What's the key challenge there for you from your perspective?
Yeah, thank you. Actually, I was not talking about closing supermarkets because they are still open, but closing street markets. So that's what is how many people work at street markets who then lose their income. How many people buy their food at street markets who have now to go to a different venue to get their food, and can they deal with additional demand in these other places and so on. So that was one question. Another question is when the borders were closed, how many people actually work across the border in the Netherlands? So how many people live in the Netherlands, work in Germany or in Belgium, or the other way around? So one challenge was to find out what were the questions. Another was, do we have the data? There's one specific element that they want to single out here, because all of a sudden notion arose, which is that of critical jobs or essential jobs. Suddenly people in healthcare or people working at supermarkets, they were considered an important group of workers. And government want to know about them. So how many people are there? Because basically everybody was asked to stay at home, work from home, and so on. How many people cannot work from home because they are in such a critical job? What about their children? Do they have children who have to be taken care of, for which you have to keep open childcare facilities and so on. So do these people have to commute? Do they need to depend on public transport? Here the question was rather, so you know this group of critical jobs, people in critical jobs. What do we want to know about them? What can we tell government? And what are the questions? So it's a matter of articulating the whole phenomenon. So what elements do we have? Can we extract from our existing data? So that's in line with what I said before. We have to actually work together with government, ask them what they want to know, offer them what we have, and then from there it's a kind of give and take process to bring together our supply and their demand, and then come up with something that is useful. So then the challenges of working online came into play that have been mentioned before. We have to brainstorm and discuss in unusual situations, and then make it all happen in a quick way, and also observing our quality standards, because we also feel a responsibility. So once we provide figures, that they also have to be reliable, of course.
And you were able to respond to most of these questions from existing data sources then, once you have sort of clearly identified the...
Yes. Yeah, that's something where we can profit from the situation in the Netherlands, where we have quite a number of very good administrative registers. We have already combined them all in what we call our system of social databases, where we can combine all kinds of data together. So we have a very comprehensive source of data sets. And then the question is to extract the right data in the right way from it. But this is not a typical situation for every country, I know, because we are blessed with the way our country is organized.
Okay, thank you very much, Bartold. Now, Frankie, from the Office of National Statistics perspective, you've talked. There are quite a few questions in the chat. You mentioned statistics related to the social isolation measures and the effects on that on the population, similar to the last question. There are also some questions about your infection survey. So I leave it up to you to which example you want to select, but if you could select an example of one of those sort of new demands or new data sources, what was the key indicator that your users were demanding, and what did you how would you sort of summarize the challenge in terms of the quality of the output?
Okay, I think I might touch on our business impact survey, which I sort of did mention rather than the infection study, because one of the key things was that the government was very interested in understanding what was the impact on individual businesses. I think, like in some other countries, the government introduced a scheme to allow businesses to furlough their staff, and the government would effectively subsidise the wages. And one of the things, so we were interested in understanding that, how many people were being furloughed from those businesses, how many people which had stopped trading temporarily, how many people had stopped trading permanently. And so we kind of varied the questions on that, but one of the big challenges in terms of quality is the response rate. So it was trying to understand, if businesses weren't responding to us, was it because they had stopped trading permanently, or because they weren't in their office, so they weren't responding. So that was one of the things we were looking at. And in the short term, we've been looking at how we could web scrape on business websites to try and understand and see whether that's because they've ceased trading completely or whether it's a temporary halt. So we've been trying to look at different ways in terms of supplementing that quality. And what we've also done is we've tried to take information about who is being furloughed and then link that into businesses to understand which ones look like they're still trading because their staff are still on their books. And then going forward, what's going to be interesting is when the furlough scheme stops or starts slowing down, whether you start seeing an increase in the number of businesses who are actually permanently stop trading, and the fact they were only able to keep going whilst they were being the wages were being subsidised. So that's but the quality issue is really trying to understand whether they were or were not in business. So that's going to be quite interesting. And that's where administrative data, when we start coming out of business start reopening, we'll start being able to see that come through into the administrative data, our value-added tax returns and things like that, to try and understand the how many births and how many deaths there are of businesses as opposed to sadly individuals. So that's just something I suppose I'll highlight quickly as I'm conscious of time.
Yeah, thank you, and apologies to all the panelists. I have to rush this a bit and ask you to sort of just identify one example like that, or pick and choose what you want to talk about. But I think we're short on time. It's very interesting how a lot of the challenges in terms of the quality of the new statistics are related directly to the pandemic itself and the social distancing measures. So as Frankie just said, it'll be interesting to see how things evolve in the future in terms of our ability to collect this new data and how the trend of the results as well. Do we have time, colleagues, Michael and others, to quickly show the results of the poll?
Yeah, maybe you can display it, and while we are doing this, I would simply start with the closing round, if that's fine for you, Daniel.
Yes, of course.
Yeah, so since we have only 10 minutes left already, kind of the extra time that we are using, I have simply one challenge to our panelists. Maybe it's possible for you in 3 sentences just to say what is your main recommendation to others who are facing similar challenges, and or what is the main take-home message you would like to give from this event. We could show the results of the poll of the previous question, but maybe Stella can then also start the last question, because we have the same question to panelists. You can write in free text what you think is the main take-home message from this event. So if that's possible for panelists to answer very briefly, maybe in 3 sentences, what is the main take-home message you would like to give to panelists, to the audience, sorry. I'd like to start again in a different order, so maybe with Angela first.
I'm really interested in the fact that we share a lot of problems that we had in the same time and that we faced in the same way, but I take a positive message. I mean, again, we find the possibility to move from to have some of good from this situation, from the organizational point of view, collaboration and smart working, and also the quickness and maybe the necessity sometimes to go straightly to the problem and to the solution in different. And I see that all the colleagues found this feeling, had this feeling and shared this feeling with among us and among their collaborators, and in the National Statistical Institutes. So I mean, we have the same feeling, and this is good, a positive one.
Thank you. Yeah, so lots of similarities, even if NSOs are working individually and very quickly reacting very quickly. And I think it will be also some work in the near future, maybe to analyze what are the similarities, what can we learn from it, and how can we improve based on this experience. Thank you, Angela. Ivan from Statistics Canada, what's your take-home message?
Thank you, Michael. Again, I think we share very similar issues, and I think that what I find interesting here is the different ways we got as NSOs to get and leverage health data. The idea of outsourcing collection for test cases, I find it very interesting. Is as a national statistical agency, we cannot do everything. But we can play a lead role. And I think playing a lead role is not necessarily doing everything. This is a very good lesson I'm bringing back. And as for maybe another thing I'd like to share is, I would say not be afraid to venture in new methods, as long as you're very transparent on how they function and what type of results they produce, as long as you fulfill the issue of timeliness and address it in a very efficient way. Otherwise, it's not worth doing it. So I would leave it there. Thank you.
Thank you. So what you're saying is always keep the basics in mind, and that's the starting point, and apply certain flexibility when it's needed.
Yes.
Exactly. Bartelt from Statistics Netherlands, what do you think? What's your take-home message?
Yeah, thank you, Michael. Yeah, first, I think we can all be very proud of the role that we play in the current crisis. So certainly we can demonstrate the value of official statistics. We can do new things based on the existing experience that you have, the background, the reputation. So I fully agree that we can take a central role here. And it's all about communities, collaboration, partnerships. So we already identified that as a core issue for our future, but now we see that in a very clear way. I hope that this is a wake-up call both for ourselves as a community and for our users and data providers, that they see our role more clearly than they may sometimes have done so in the past. Thank you.
Thank you. So what you're saying is also like the value of official statistics becomes more visible, actually, through this this disaster. Yeah, thank you. Frankie, what's your take-home message?
So I think there's something. I think the take-home message is that it's a tragic situation, but that that has given an acceleration and an urgency about some of the transformation and changes that we wanted to make as a system anyway. And I think that's really important. I think don't forget that timeliness is a key element of quality, and therefore some information might be better than none, particularly at the moment. And then finally, I think for me it would be, how do we make sure that we continue to move forwards, and that when things return to a sort of, well, I don't think it'll ever be the same, but a more new normal, whatever that is, that we don't lose some of the gains that we've made, and that we continue to really make sure that forward progress is maintained and sustained.
Thank you very much. This was also very inspiring towards the future. Isaac from INEGI.
Well, thank you, Michael. My take-home message is that the crisis imposes challenges that requires the development of new methodologies for the capture of information. So this situation should be anticipated for future events. Nowadays, it is important to have a geographically organized telephone directory that serves to obtain scientifically samples of both fixed and mobile phones. It could be a good exit in the case of Mexico. And likewise, the pandemic arises to carry out the necessary legislative steps to facilitate the obtaining of information via administrative records in a more timely manner. That's a pending task in Mexico, for example. Another important lesson is the usefulness of an approach to the private sector and other relevant actors to obtain information such as Google, Facebook, Twitter, and credit card issuers, as well as internet or telephone service providers, whose user information can be very useful in the generation of statistics. We should open our minds to get information from those kind of services, private services. That could be a possibility, a solution, in order to get the data, the raw data that we need for our statistical programs. Thank you very much.
Thank you. Saying also, this helps to accelerate this collaboration, exploring of new data sources and new ways to generate official statistics. Yeah, thank you very much for this. And we have Mattea from Statistics Austria. What's your take-home message?
Yeah, I agree with the things done by the other panelists, and I think what was my take-home message here is that it's important to have such talks like today, because if I see what is done by other NSOs and what can be done with data and how they are sharing the data and how they collaborate with others, I think this gives us a lot of ideas what we should do in the future. So I think talks like that and sharing ideas, sharing work that has been done are very important also for our future work.
Thank you very much, Mattea. This actually leads me to my closing. I think this is also very important to hear from you, that this event is useful or has been useful. And I can also see the discussion has been so rich. There is such a big information demand and demand to exchange experience, but we cannot facilitate this in such a short time. And we know that video conferencing is an additional challenge to this. Thank you very much to this. I would like to thank all the panelists and for all the questions that came. In my conclusions, I just would like to say what comes next. We will take these questions that came through the chat, and we will reach out one more time to the panelists if there is specific technical questions they can react on. So please, that would be very nice if you could answer to these questions, and we would then share it, of course, with everybody. We will make the recording of this event also available on our meeting website. We will inform all participants about this, so you can then also share it with colleagues who could not attend. I also would like to inform you that we have the Conference of European Statisticians meeting, so all the chief statisticians of our region and OECD countries meeting in 1 week time, virtually, most of them. Usually they meet in Geneva or Paris. And actually there is one session also dedicated to the role of official statistics in managing the COVID-19 disaster. And we will use some of this information that we have gotten today from the discussion also to structure and to feed into this session. So this is also one follow-ups. You will receive, all of you, an evaluation survey electronically. My colleague Stella will send it out to you, and this evaluation survey also includes questions about what could be the follow-up. So should we organize a similar event in the future? Maybe it can be focused on one specific topic. Like I said, it could be, for example, health data in collaboration with the health authorities, which came very often. It could be also, I just give you examples, more elaborating about the challenging of data quality or statistical confidentiality. So there are certain topics that everybody, that we all have in common and which might be worth to look at specifically. So that's it from my end. Again, thank you very much to all of you. Apologies that we could not address all the questions. That was clear from the beginning, but we would like to follow up as good as possible. And I would like to encourage everybody to fill in this evaluation survey, because it will also have an important impact on how we are continuing working on this and how we will design our follow-up activities. I'm not sure if Daniel also would like to, and Stella would like to have something in addition, mention something in addition. Daniel?
No, thank you very much for inviting me. I think it's, as you said, a very rich discussion. Thank you to all panelists. I have nothing to add right now.
Stella? Anything you would like to add?
Dear colleagues, I would like to thank everyone for participation and for the interesting discussions. And please keep connected and with our follow-up events and measures. And looking forward meeting you next time.
Thank you. So I officially close this meeting here. One more time, thank you to everybody, and there will be a follow-up. And please reply to the evaluation survey. Most of you statisticians, you know how important the response is. We've heard this from several of you, so please help us to increase the response rate. This will influence the way how we follow up. Thank you very much, and hereby the meeting is closed.